Okay, YouTube. Um, it's about 3.5 weeks, almost 4 weeks now, post-op. And I want to talk about something that's been bugging me a little bit in the kind of the past 4 or 5 weeks as surgery has approached and people have congratulated me and whatever. And one of the things that I've heard quite a bit is this idea that somehow now I'm my real self or a complete woman or whatever. And I want to kind of nip that in the bud and say that no, that's not the case, because there's a couple things going on there that I think need to be addressed. And first is this idea that somehow SRS makes you done or complete or whole or whatever, and that's really offensive to people who are not op, because what does that make them then if SRS is kind of the end state? Um, they're not incomplete. They are, you know, who they choose to be, and that should be respected. And saying those types of comments, I think, is disrespectful. But beyond just that, there's the fact that, um, SRS isn't a magic bullet, and it's not going to make life, you know, whole or complete or whatever for these trans women. In fact, I would say that the last thing you do should be SRS, because like if you have this really strong dysphoria or whatever, like, yeah, getting rid of your genitals might help, but like I know people who can't get over the fact that they weren't born cis, and it's like, you're trans, you're always going to be trans, and no amount of surgery is ever going to change that fact. So it might make you look more cis or more attractive or whatever your goal is, but it's not gonna make you cis. And if you can't get past that, if you can't figure out whatever your coping mechanism is or sort of how to move on, then no amount of surgery, no SRS is really gonna be that helpful. And I think that's the thing that a lot of people don't necessarily think about unpacking or can't or whatever. And there's even some evidence to suggest that that's the case. There was a study put out in Sweden, I think sometime around February of 2011, if you want to Google Scholar it, about the long-term outcomes of SRS patients. And it's a small sample size, naturally, but a lot of those women attempted suicide or kind of had behavior or outcomes or whatever that were much higher than what their cis control groups experience in terms of suicide, attempted suicide, depression, all sorts of things like that. And the reason is because SRS doesn't solve a lot of your problems. It solves one problem, which is having a penis. And I really look forward to wearing yoga pants and bikinis and not having to worry about my tuck, and even having a, functional vagina, which will change the way I have sex. But, like, I could have survived for the rest of my life, probably with a penis. But, like, I was able to get SRS, so I took advantage of that opportunity. And it really took me until a few months before SRS to kind of get past this idea that, being trans is somehow being a fake woman or whatever, because um, I had to unpack that, I think, to be comfortable with everything else moving forward. And now that I am, I'm just kind of like, yep, it's there, it's right, whatever. But it doesn't, or it hasn't so far. And yes, I know I'm still recently post-op, but I'm not expecting it to change my quality of life all that dramatically, because I'm still going to be open and honest about being trans with potential partners, and they're going to take that however they were going to take that. So, um, it's nice to have that done, but this by no means completes me or makes me a real woman or whatever, because I feel like I was already those things before I even stepped on a plane. for surgery. So